Now, talk more about China's strategy to fight cancer. We heard a little bit there, but give us your thoughts.
Thank you for having me. China has been taking multiple approach to fight cancer. The first, most important thing is the prevention and the risk reduction. So not only looking at the patient, the cancer patient, but the healthy population, initiating public health campaigns to promote lifestyle change, like smoking cessation, like healthy diet, and increasing physical activity. And also there are some multiple vaccination programs like HPV programs for cervical cancer and hepatitis B vaccines to prevent the liver cancer. So also China in recent year has been implementing the Air 10 plan to significantly reduce the environmental exposure, to reduce exposure to carcinogens. So that's the prevention and the risk of production. But also what's very important is about early detection and screening, as the government has been implementing national cancer screening program, especially for some high-risk cancers like lung cancer, colorectal cancer, breast cancer. And more recently, the AI and the big data has been leveraged to improve the diagnosis through imaging and the predictive analytics. And beyond that, I think China is trying to build in some more like treatment and healthcare infrastructure, like using more cutting-edge treatments and building some more cancer treatment centers, especially in less developed rural areas. Beyond that, there are some policy change, like the Healthy China 2030, which significantly targeting those to increase the cancer survival rate by 15% over the next 10 years. And also increase the funding for oncology research. And the last thing is more financial support. We know that cancer drugs has to be more approved by the China's FDA, which involves some imported drugs. So China is trying to include more such innovative drugs into the reimbursement list. So that's what China has been trying to do. But as the funding for the reimbursement list has been limited, and China is thinking of having a third list that including some more like commercial health insurance plans as well as more innovative drugs.
And is this all part of the Healthy China 2030 plan that aims to improve the 5-year cancer survival rate by 15%, I believe? And do you think this is achievable?
Yeah, China actually have multiple indicators for each outcomes of Healthy China 2030. Some other indicators already being achieved, like lowering infant mortality and maternal mortality. So the cancer survival rate is something very challenging, but I think giving another 5 to 10 years is very promising.
And how prevalent is the use of traditional Chinese medicine to treat cancer? Is it something that's used alongside modern medicine?
Right, it's more used as a complementary treatment option. I think everything is on the table, including traditional Chinese medicine, but more like a stringent and well-designed studies has to be improved, to be conducted in order to show that this is very effective. Because I think eventually China wanted to promote the traditional Chinese medicine, not only domestically, but also in the global market.
All right, Xi Chen, we'll leave it there. Really appreciate your time.
You bet.